now, go back. Today I am going to talk to y'all about why not to join a Medicare Advantage plan. I want to argue that you should not join or encourage any of your family members to join a Medicare Advantage plan because of their hidden copayments and restrictions on your health care. There is no such thing as a free lunch. I'm sure some of you have heard that saying before. What that simply means is that nothing's free. Nothing comes free. Someone is paying for it. You may not be paying for it, but someone is paying for it. And that's the way I feel about Medicare Advantage plans. We all work in the healthcare industry and should be able to advise our patients and our employees and our family members on whether or not to join a Medicare Advantage plan if the subject comes up. I have worked in healthcare for 20 plus years. I have worked with many many Medicare Advantage plans on the billing side, on the provider side, on the authorization side. You know, they are very difficult to deal with as compared to just regular traditional Medicare. So that's my credibility in this, and I've also done some more research in the past week or two for this class to be able to present this speech. So let's begin with a little background information. What is a Medicare Advantage plan? And some of you may not know. It replaces traditional Medicare. And by traditional Medicare, I mean when you turn 65 and you get Medicare, and you get your Medicare card, the red, white, and blue card. That is, Medicare Advantage plans replace that. In other words, you don't have Medicare anymore. You have a Medicare Advantage plan, which is a private insurance company. It's not ruled by the government, although they do have to adhere to Medicare rules. Medicare Advantage plans include Part A, Part B, and sometimes Part D. Part A is the hospital insurance, which means if you go inpatient somewhere in a hospital setting, then that Part A covers that. Part B is called the medical insurance, and that's like when you go to the doctor, or when you have an outpatient surgery, or when you have outpatient physical therapy, something like that. Home health, which is what we do, is covered under either or. If you've been in the hospital, then the first 100 visits or so will come out of Medicare Part A. After that, they come out of Part B. So it doesn't really matter which one you have. It'll cover home health. Medicare pays these Medicare Advantage plans a predetermined amount per beneficiary. They determine that, and they're all paid differently. So if Linda and I were on the same Medicare Advantage plan, then they may pay more for her than they would me. It just depends on what the background of our information is and what that Medicare Advantage plan agrees to accept. According to the Milbank Quarterly, the goals of starting this Medicare Advantage plans were to give the beneficiaries a choice and for Medicare to save money based on the private insurance industry's efficiency in running health care. An article in the New York Daily News by Phyllis Thurman noted that a Medicare enrollment is growing 10% annually over the past few years. So it's getting out there. People are understanding more about it, and some are not understanding more about it. As you know, you've had patients, you've had family members where they come to their house and they try to sign them up immediately. Try to sign them up on and tell them, oh, it doesn't cost you anything. Just sign up. It's better than Medicare. Blah blah blah. In his book, Social Security, Medicare, and Government Pensions, attorney Joseph Matthews describes two opposing views to a Medicare Advantage plan. The first view we will discuss is that Medicare Advantage plans provide cost-effective health care. They start out with telling you that there's low premiums. They have A lot of them have either no premium or a very low premium. The second thing that they tell you is that they have additional benefits that Medicare doesn't cover. Vision sometimes, dental, wellness benefits. There's a senior program that they actually can go to a gym and have gym membership that's either at a reduced rate or a free benefit to them. Traditional Medicare does not cover this, and neither does the Medigap programs. And the Medigap programs are basically a supplemental insurance to Medicare. A lot of people, if they don't get a Medicare Advantage plan, they have Medicare plus a Medigap program, which is just a supplemental policy that covers what Medicare doesn't cover. The third benefit that they tout is that they're a one-stop shop. A lot of them have the Part D coverage, which is the prescription drug benefit coverage, and so they say that you don't have to have all these other programs. You bill one company and they cover everything. Mr. Matthews' second viewpoint is that Medicare Advantage plans are the insurance business's way of obstructing quality health care. So these are obviously two opposing views. I tend to go with the second viewpoint. My opinion is that some of the ways that they obstruct is that just because they have a lower premium doesn't mean that you're not going to pay. They have hidden co-pays and deductibles involved in there that you may not know anything about if you don't ask. Because they're not going to tell you up front. It's going to be in the paperwork that you sign, but they're not going to tell you up front. I've listed on here the Medicare co-pays and deductibles for this year and next year. They go up every year. You know, that's our government at work. They go up every year. In 2014, the deductibles are going up as well as the copay. The premium for Part B, which everybody pays a premium regardless of whether you're in a Medicare Advantage plan or not. You have to pay the Part B premium, and that's not going up. That's one thing that stayed stagnant for the last few years. My suggestion would be to read the fine print. If you are going to go with a Medicare Advantage plan, or if they do come to you and try to sell it to you, read the fine print. Ask what copays and deductibles are there for what situations. Sometimes with outpatient therapy, they have a copay or a deductible attached to that. Medigap plans cover that of Medicare. The ones that are on the screen here, Medigap covers those deductibles and copays. So it's not anything that comes out of your pocket. My mother has Medicare and a supplement insurance or a Medigap plan, and she's had 2 knee surgeries, a gallbladder surgery, and been in the hospital about twice on top of that, and has never had to pay another penny other than her premium that comes out every month. Another thing that they take away from you is your choice. You have to go in network with them. Their providers have to be in network. If you're not in network with them, a lot of times it's not covered at all, or it's covered at a reduced rate. If your provider is in network, what kind of care are you really getting? Are they happy to be in network? Are they getting they're obviously getting a reduced rate, because somebody's got to make money here. If Medicare's giving them money for you, then it's supposed to be, less, cost Medicare less, then, how are they going to make money? According to an article in the Tampa Bay Times, the average Medicare Advantage payment is 114% of the traditional Medicare rate. So they're making 14% more than Medicare makes on a beneficiary. Not make the rate. That's not even their profit. That's just what they're making on an average doctor's visit, or an average hospital stay, or an average home health stay. To me, this forces providers to sacrifice quality. And this has been, my take on the last few years when like I said, I've been in home health and understanding that we can't always take a Medicare Advantage plan. Either we're not in network and they won't let us be in network because they're not accepting new providers, or we're in network but they say, well, you can't provide that care, even though that's a Medicare beneficiary, and under Medicare we can cover, that care is covered, it's not covered under them. So you have to weigh the options there. You know, what your choice is taken away, you have to understand what is, you know, what am I really getting for my money or for no money. So today I've given you several reasons that you should not join a Medicare Advantage plan. How will you spend your retirement? Medicare Advantage plans may look good on the surface, but their hidden fees and restrictions make them a choice that I think is not for your health care needs.